Okay, we'll get this public caucus going tonight. Tonight we have Mr. Alex Hazzouri, President and CEO of the Friendship House, to give us an update on the Friendship House plans for the Murray Building on the 400 block of Biden Street. So, Mr. Hazzouri, thanks for coming in. You have the floor.
Thank you, Mr. Donahue. It's a pleasure to be here, and thank you for the invitation. Yesterday, the Friendship House purchased 3 parcels yesterday was Monday, and Friendship House purchased 3 parcels in downtown Scranton. What is known as the Murray Building on 413, 415 Biden Street, the Davidow Building, which is next to the Murray Building, and the address is 216 Wyoming Avenue, and the parking lot across the street from the Murray Building, now to be known as the Friendship House Building, at 420 Biden Street. We have some very significant plans for all 3 of those properties. Friendship House is working to establish a whole person care center in the Murray Building, the entire Murray Building, which is approximately 12,350 square feet, as well as the second floor of the Davidow Building, which is approximately 11,500 square feet. Whole person health, whole person care is a concept where almost all aspects of an individual's health care are addressed. In this facility, we will provide mental health services, substance abuse services, physical health care, and pharmacy services across the lifespan, children, adolescents, and adults, for all citizens across socioeconomic strata within Lackawanna County, and beyond if folks so choose, and I think we will be that good that folks will choose to come here. The method of payment, a lot of folks are interested in that. Method of payment, we accept insurances from medical assistance and Medicare through pretty much every private insurance provider throughout northeastern Pennsylvania. And if someone doesn't have insurance, we have a sliding fee scale based upon need. We're hoping to finish the project our objective is to occupy and deliver services by January 1st of 2023. And we will be providing, which is important, it might sound like a minor point, but it's important, not only will we be providing free parking for all of our staff, but we will be providing, more importantly, free parking for all folks, patients, clients that come for services at our facility. We have the parking lot that we purchased, as well as we'll be using the Scranton Parking Authority to purchase parking spaces in their garage, or garages, depending on the preference of some employees. But patients and clients will have surface parking directly across the street from the Friendship House Building at 413, 415 Biden Street. We're excited not only about the project, but we're equally as excited. We're not only excited about the project, whole person care for every person. Like so many other nonprofits, I'll be bold enough to use the example of Geisinger, a mission-driven nonprofit corporation providing excellent services. We're the same type of organization. We currently provide excellent services, but we wanted to bring it downtown for a couple reasons. One, we want to make it available for all of our citizenry. I think there's something like 1,300 apartments in downtown Scranton. I believe that might be the number. There might be more. All of those individuals who can take advantage of these services. The University of Scranton, Lackawanna College, the building is at the intersection of 17 of the 23 bus routes in Lackawanna County. We couldn't get more central. The only more central to downtown Scranton is the county courthouse. So we wanted to be in downtown for that reason, but Friendship House believes in downtown Scranton. We believe that the physical health, the image that Scranton portrays, is important to the mental health of individuals throughout the county. And the individuals we serve now and we'll continue to serve, and new individuals that will take advantage of this facility, will be proud to walk into a show place, not a Taj Mahal, but a good, solid facility that they'll be proud to walk in to avail themselves of whatever services they need. Folks that get mental health services also oftentimes have co-occurring disorders and have substance abuse issues, and sometimes, and vice versa. And oftentimes folks with mental health issues and substance abuse issues aren't getting their physical issues addressed. So having everything there will make for and allow for a much healthier population within Scranton and all of Lackawanna County. I'd like to stop, well, a couple more things, and I'm happy to answer any questions or work to answer, try to answer them. I believe we'll have about 50 staff in that building when we are fully operational. We, right now, will have at different times of the day 4 board-certified psychiatrists in adult, child, adolescent, and substance abuse. Adult and child psychiatry and substance abuse. We have right now 2 physician's assistants as well as 2 certified registered nurse practitioners, and among the 4 of them probably have over 45 to 50 years of specifically mental health psychiatric experience. So I'd like to stop there and answer any questions you might have.
Does anyone have any questions?
So, Alex, I appreciate you being here tonight.
Thank you.
So, I knew that you'd be coming here. I didn't know a whole lot about the project that you were doing. So, a couple, first, about what you're going to be offering to clients. Now, are the services that you're offering to the clients at Friendship House, is this a fairly new aspect of what Friendship House presently offers?
Thank you, Councilman. That's a very good question. Friendship House traditionally has been known as a provider of services, whether they be mental health or autism or other child welfare services to children and adolescents. This past November, it was 3 years, Friendship House opened up a mental health clinic in Mayfield. And we began at that time to serve across the lifespan, children, adolescents, and adults. We just recently opened a clinic in Montrose, servicing children, adolescents, and adults, and our small Honesdale clinic just still serves only children and adolescents. So serving adults in this part of the valley is brand new to us. Also, substance abuse services is absolutely brand new to us. We're in the process right now of applying for and hopefully, I'm sure we will earn the licenses from the Commonwealth and get accredited by the insurance carriers. So those are 2 new things. But the dynamics of mental health often affect a family where the child and the parents are both affected by mental illness or substance abuse. So we're able to deal with not only a whole person, but a whole family. Okay. We're also bringing a great innovative service to downtown, and I know Councilman Schuster's in the mental health world. He might be aware of this service, parent-child interaction therapy. It's a evidence-based therapy where children with specific behaviors between the ages of 3.5 and 7 are treated by specifically trained master's level mental health clinicians. And the modality is this. There is a room where the therapist sits with a microphone, and the parent or guardian with the child is in another room through a mirror that only can see one way. And this specially trained therapist, utilizing this evidence-based practice, works with the parent or the guardian to give them cues on how to better interact with their child or their ward, and we're very excited to bring that to downtown Scranton.
Thank you. So, I'm just trying to get a grasp on this. So the services that you're offering, I'm just thinking about, is there overlap with what DATS currently offers and what Scranton Counseling currently offers?
Well,
And has there been an identified need that goes beyond what they're capable of handling?
The provider you referred to, Drug and Alcohol Treatment Services, they do provide outpatient and perhaps some other types of drug and alcohol services, but Friendship House will be providing them in collaboration with physical health and mental health. There is no overlap.
Okay. And in Scranton Counseling, is what you're offering here similar to what they're offering?
Yes, similar.
Okay.
But we're in downtown Scranton, convenient to so much of the citizenry, not only of Scranton, but of Lackawanna County. As I said before, the intersection, the accessibility, the presence. It brings unfortunately, there still might be a little stigma in our communities about mental health and substance abuse services, and that should not be. And I think this will allow folks to understand more that, yes, this is as much a part of where we live as the arts is, as our beautiful residences downtown, as our retail shops are,
Okay.
and our churches and everything else that is in the central business district.
Okay, thank you. And so the building, the Murray Building, that was formerly housed the Lackawanna County DA's office, correct?
Yes, sir.
So they moved out of there, didn't they? Or
They're up
okay.
in the Gateway Center now.
So when they moved
by
out,
Radisson.
did this property go back on the tax rolls? Like, who owns it? Who did you buy it from?
Councilman, if I might answer Councilman King's question, the property was owned by an LLC, two individuals, and of course, they always pay taxes.
Okay.
Yeah.
I assume they always paid their taxes. It was a tax assessed, and all the taxes were paid.
Okay.
Friendship House will continue, of course, when we closed, we pay taxes till December 31st of this year. We will continue to pay taxes, will not ask for any tax exemption on the Davidow building, specifically because the first floor is retail space. There are
Okay.
about 9 retail locations on the first floor. But we will use the second floor for our purposes. And we will ask for tax exemption for which we believe we qualify for both the Murray building and the
Parking area?
and the parking lot across the street, which will be used by staff and patients, individuals that we serve.
Is the pharmacy going to be in the Murray Building, or
Right now, we're in conversation with a local family-owned pharmacy, and most likely that service would be provided from the Murray building, but as the design moves forward, it could be provided from the second floor of the Davidow building. We will have services on the second floor of the Davidow building.
So the tax exempt piece would be the Murray Building?
Yes.
Where most of your services will be provided. And are you saying the second floor?
Second floor of the Davidow, we would grow into the second floor. Probably, final design is not complete, although it's in process and has been for a couple months. We probably, in the beginning, will occupy upwards of 40% of the second floor.
Okay.
And then, I think eventually, the entire second floor.
Now, the parking lot that you're planning, you just purchased, who previously owned that parking?
That was the same owner, the same LLC that owned the Murray building. The same 2 gentlemen had 2 LLCs. One owned the Davidow building, and the other LLC owned the Murray building and the parking lot.
And they were paying taxes on
Yes.
that as well?
Yes.
Okay. All right.
Yes.
So you'll be seeking tax exemption for the parking lot, for the Murray Building, and the second floor?
No, we will not ask for tax exemption for the second floor of the Davidow building.
You won't? Okay.
We will not. We
Okay.
will not. And we believe that the value added to our community by Friendship House, not only by services, but by investment in a major intersection, will supplant those arguments or the reality that we will be asking for and hopefully earn the tax exempt status from to tax exempt status for those properties. Just as an example, the sister corporation to Friendship House is the Advocacy Alliance. Some of the folks here might have heard. I'm blessed to be the CEO of both corporations. We're under one nonprofit umbrella.
Is that on Jefferson Avenue?
On Jefferson Avenue. If you look at the 9 buildings that we own on Jefferson Avenue and one on Myrtle Street up, they're meticulous. I believe they're an asset to that neighborhood. And out of those 9, when we bought them at different times since July 1st of 1995, they have been either condemned or in uninhabitable condition. Most of them, all but 2. So we
Oh, yeah, I'm familiar with those
Yeah.
properties, and I've been in,
so
actually.
it will be an asset, and we believe it will supplant the loss of taxes to the community.
And I'm not sitting here saying I'm against that. I'm just truly trying to get a picture of what we're looking at here and
Yeah.
what you're asking for. I don't even know if you're asking or if you're presenting this to us just for information purposes or what, but.
Yes. I forward the information to council folks as well as your clerk, and just for information purposes.
Okay, I
Yes.
appreciate that.
Oh,
Thanks, Al.
absolutely.
Does anyone else have any questions?
I do. First, thank you for coming tonight and presenting your vision for the Murray Building. Look forward to seeing what comes of Friendship House. I think it's exciting plans that you're presenting to us tonight. But I did want to ask, you'd brought up a couple times about physical medicine that you'd be including in your services. I don't know that you went too much into that. I was just wondering what that would entail, what type of physical health services.
Mr. President, I can't,
I'm sorry.
Councilman
Are you having trouble hearing
Rothschild,
me?
I can't, because of
Okay,
the mask. I'm
maybe the
sorry.
acoustics. That's fine. I was wondering what the physical health services were that Friendship House was going to offer.
Full primary care physician services at a minimum. We are collaborating at this time with Scranton Primary Health Care Center from the corner of Wyoming Avenue and Ash Street, catty corner from Scranton Prep, and they will be locating physical health services within our building. And that's just going to allow for opportunities where, especially folks, and what's great about this is it's not only for richer and poorer, for older and younger, but it's also for people with serious mental illness, but folks with episodical mental illness, which affects all of us, all of our families, usually, or substance abuse, whatever level it might be. So it's for the entire community. But so many times when folks have either substance abuse or mental health or the co-occurring, the physical health falls by the wayside, and these behavioral health problems cause ill physical health. So we're excited to have it all right there. That's going to be that, and that's evidence-based. That's proven that enhances individuals' overall health and quality of life.
That's great. Thank you. Appreciate it.
Thank you, Doctor.
Does anyone else have any questions?
Yes, so I'm taking this as an expansion, correct?
Yes, yes.
So with that being said, you're going to continue to keep your current facilities, your East Mountain facilities, your other offices, you're just moving into 2 other buildings, correct?
Yes, we are on East Mountain. Mayfield is not affected by this, nor Montrose, nor Honesdale, nor Friendship House has 90 staff embedded in schools throughout northeastern and north central Pennsylvania. However, we are taking from East Mountain, 1509 Maple Street, we are taking our child adolescent mental health outpatient division, which occupies approximately 6,800 square feet on Maple Street. We're moving that downtown, but then we're adding in and some other ambulatory services that go along with outpatient, like case management. But then we're adding adult and substance abuse and physical health. So it is growth.
Yeah, so it's great to see that. I mean, I don't know anybody else in Scranton. I know in the Wyoming Valley and in the field itself, it's spreading to the whole spectrum of care. So it's good to see that Scranton is coming into the future with the full spectrum of care, taking care of, you know what I mean? When you get into behavioral health, it starts at a young age, maybe kindergarten, first grade, second
Yeah.
grade. But then that piece of the pie that wasn't covered was that adolescent age going into adulthood. And I mean, if you find a doctor you like, it's good to stay with that doctor that you like throughout your life. So it's great to see that that type of service is moving to Scranton.
Thank you. And Friendship House is not only, just sort of reiterating what you say, we're not only excited about what we're doing for our community, the community of which we are a part, we're equally as excited about the city of Scranton and what this says about us as a community, that we care and we understand and we're at the edge of doing good things for ourselves.
Alex, just back to East Mountain. So you're going to be pulling those services out of the Maple Street building on East Mountain. Is that closing?
No, that's as Councilman, as you're probably aware, that's about a 52,000 square foot building. We're just going to be pulling out child adolescent mental health, which is approximately 6,800 square feet, just that.
Oh, okay, just that piece.
Just that small, in terms of the physicality of the building, that small piece, less than 13%.
Okay, thank you.
And with that, you're moving other services into that space, correct?
Well, yeah, our case management services are on Maple Street, but as if I may, as you are aware, case management is so ambulatory, and especially during the pandemic, case managers, our blended case managers or supports coordinators are almost never in the office anyway. They're on the road all the time. So that's and they don't maintain offices. Case managers, supports coordinators maintain sort of a hotel space at a podium type thing to come in, do their work, and go back out.
Does anyone else have any questions? Thank you so much for coming in. We really appreciate it.
Thank you.
Appreciate the update.
Thank you very much, Mr. President. Thank you.
Thank you.
Thank you.